HRT, TRT, steroids, and maybe we should let the listener know HRT is hormone replacement therapy, which can
Right.
be male or female. Estrogen, progesterone on the female, testosterone, human growth hormone. Well, I guess women that too if they would need that. But then you have TRT, which is testosterone replacement therapy. Men are seeing a decrease in testosterone, and then you have steroids, which would be they're taking they're taking testosterone on their own, maybe from a doctor. They're also taking like Anavar or Anadrol, Dianabol. They're taking some growth hormone. So steroids, when somebody's on steroids, they're just overcompensate. They're just taking way too much. And I think that'd be a good way to break it down for the listeners so they understand. But I think the thing, a lot of what's going on with hormones, and this I'm leading in, then I'll just give you the microphone, is cholesterol, yes, but also, what do they call those? Endocrine disruptors?
Yes, endocrine disrupting chemicals. So
Yeah, and we're seeing that in our hair
EDC.
products, deodorant. So I think that's why I like you do functional medicine, because so many people are going to the doctor, give me TRT. But if you're getting enough sleep, I mean, I'm sure firemen have low testosterone because of that, right? Sleep,
Yeah,
proper
absolutely.
diet. So maybe you can unpack that whole topic. And
Oh
I'll
my gosh. Okay, so yeah.
in under
So
5 minutes, right?
okay, so
No kidding.
see, where
Yeah.
do I jump into there? Okay, men, okay, hormones, okay, testosterone counts, sperm counts. So back when 40 something years ago, okay, when I first came into this, the ranges for sperm counts were like this. Okay.
Okay.
It, down here, this is bordering infertility. Okay.
In the
So
1980s?
this is in the this is in this would have been 1980 thereabouts.
Okay.
Okay. So below this is infertility. Okay. So now our new norm is this.
Oh, wow.
Okay. So uh,
Wow.
our our range. Well, I thought this was infertility before. Well, no, that's now the new norm. So our fertility has dropped off tremendously. So that is due to some of the things you mentioned
Yeah.
with the endocrine disrupting chemicals. So if people want to look that up, I mean, they can go to the Endocrine Society and uh, look at some of the studies or some of the list. There's so many chemicals out there.
And
For instance,
what is the endocrine system? That's actually the hormonal
okay,
system,
that is the
thyroid,
hormone.
hypothalamus, adrenal glands.
So all of yeah, from your hypothalamus to your pituitary to your thyroid to your adrenals to your gonads,
Okay.
all of those are part of the endocrine system.
Okay.
And so you see an endocrinologist because of an endocrine problem. So um, the endocrine disrupting chemicals disrupt the normal uh, um,
Well, yeah.
the normal flow of the hormones and their effect. So anyway, we've had a drop off in men's testosterone to a degree. Um, Other things in our foods. What is it? Sodium, aluminum. Is it phosphate? It shows up in almost every baked food. It's kind of one of these. I don't know whether it's an anti-caking agent or something, but it's in most
Like
of.
emulsifiers, or
I don't know if it's an emulsifier, but it's one of those food ingredients. I'm sorry,
arginine,
I
carrageenan.
I don't remember exactly, but it's found in a lot of those foods. But it's an aluminum product, but
Okay.
it drops sperm counts and it drops hormone levels, and so we're seeing that in men. You mentioned occupational risk like a firefighter. Well, they have disrupted sleep, and sleep is so important
Mm.
for natural hormone production. So I probably have more firefighters that I see for low T than anyone.
Wow.
Okay, it's almost okay. They don't have any problem for the first 3 years or so, and then all of a sudden they start noticing it. And these guys really, I mean, they're young, they're healthy, they're working out, and yet they're starting to drop off.
Mhm.
And I try to use and exercise to optimize testosterone. And you know about this, and I mean you can triple some guys' testosterone just by doing this if everything is working right. But men will have a drop off starting after about age 30. They really peak with their testosterone, not when they're a teenager,
In their
but
20s. Yeah.
yeah, 20, 25, something like that. And you really don't drop off until after 30. But when I hear from some of these men's clinics, at least the patients tell me, they said they're going to make my testosterone that of a 16-year-old. And I said, well, a 16-year-old doesn't have that high, believe it or not. It's actually later.
Right.
And but this is what they're telling guys, and they're saying everyone has levels up here. Well, those are out of range. And if you really look at the average ranges, we're much, much lower. Now, again, all that said, we have problems with endocrine disrupting chemicals. We have other things impairing our testosterone. But
And while you're thinking there too, I think this is an important point on testosterone. When you go get the injection, right? And some doctors recommend cypionate, ethionate, propionate, and they all have different esters. So they're going to maybe stay in the body longer. Testosterone suspension, which is water-based, but these are synthetic. So your testicles are basically going to shut down. It's going to eventually stop producing your testosterone. Now you're relying on the synthetic testosterone, which, in my opinion, it's harder for the body to regulate. And that's why you'll see emotional highs and lows, angry, mood swings. So many things can come in. So my point was, you got to be very careful and make sure you're doing it for the right reasons as a last resort. Because so many guys do, they want to get bigger too. They think, oh, I can take steroids now,
Well, that's where most of these these guys are aiming, and they're listening to some of the men's clinics out there that are telling them this, and it's really not true. I'm all into balancing.
Yeah.
I mean, having low T, no fun, and
No,
these guys they have no energy. They're dragging. They're irritable and moody. They got the grumpy old man syndrome.
yeah.
They're depressed. I've had guys coming in after they've been treated with 4 or 5 antidepressants. None of those worked.
Right.
And when I moved their T up, okay, all of a sudden they lit up and they're going, oh my gosh, I feel normal.
Mm-hmm. So in those cases, you would recommend it. I probably would too. A fireman who needs to have his job, and that's what it's there for.
Right.
But is there other? Do you try? Let's say they're there. Can they make up that sleep 4 days a week and begin to change their diet and lose some weight, or is that is?
It's very difficult with their schedule.
Yeah, it is. Yeah.
You end up getting disrupted sleep more and more. Now, I've treated many of them after they retired. Okay, they still have some issues, but they don't have the same issue.
Got it.
But again, at that age, I mean, they're retired.
Yeah.
But again, many of them retire young from the fire service. But anyway, that's kind of a subset out there. But most guys out there, it's due to their diet. It's due to eating improperly.
Stress too.
Yeah. Yeah, and the stress releases cortisol, another steroid hormone, and that causes you to gain weight, and it causes problems with the brain and the function up there. It affects your hippocampus, and anyway, it gets back to diet. Okay. Yeah. And so I try to change that as much as I can. If I can't, okay, then we can look into other ways of going about it. The different forms of testosterone replacement would include injections, as you mentioned, pellets.
And the pellets are injected or placed into the glute, and they're on time release.
Right, and you after 6 months, but you have to dial it in and you have to make sure you get the right, because, well, you don't take it out. Okay. No. It's going to be there. So if you overshoot, I had a guy, I measured him He's actually in the fire service.
Yeah.
And I measured his testosterone at 6 months post last pellet,
Whoa.
3,000. Okay, so
Oh,
if you're going over 1,000, that's that's actually out the more
yeah.
than two standard deviations from the average.
And are we looking at free testosterone, the testosterone that's active, or do you look at both reading?
I always look at both, but his total was it was so high. It was like almost, it was 3,000, and that was at 6 months, and he was shocked. And I said, "Do you know what that means?" And he goes, "Yeah, they screwed up.
Yeah. But did he
They
have mood swings or anything from that level
uh,
of,
well, yeah, he wanted me to take over his care because he says something's not right.
well, yeah, that, yeah, no kidding. Wow.
So anyway, you can get into trouble with the pellets. It's basically a money maker. That's why they do it.
Yeah.
Okay. So, and it's a convenience. So you don't have to worry about anything and you get a steady state. Well, yeah, theoretically, it's a great idea. It's not practical for everyone. Maybe they can't afford it. Insurance isn't going to pick that up. The, uh, the testosterone injections, say for instance, like Cypionate, well, you get a peak and then you get a trough and you get a peak and a trough. So you get this sawtooth type
Hmm.
curve. So I don't like the peaks. If they go too high, they become irritable and moody. And, this is where you get, it can affect your moods. Okay. So if you get a nice steady state, there's usually not a problem.
And your
But
body, that's what your body does naturally, right?
right, your
Ideally.
your your testosterone is going to be kind of steady. I mean, it peaks in the morning and then drops off throughout the day.
Right.
But these guys are having really highs and lows. And then the problem with the highs with the injections, you're going to get red blood cell hyperplasia or overgrowth of red blood cells. So your blood is getting thicker. And that's not necessarily a good thing. And
Right.
so those guys, I would say, well, you're going to have to, if you're getting up there and we can't avoid it, you're going to have to donate blood and just to
Get
kind
rid
of
of it. Yeah.
drop the hemoglobin hematocrit down to a reasonable range. And so they might do that every 8 weeks, but that's not my ideal.
No.
As they get down to the lows, then they're feeling, really yucky. Now, I have guys that, they don't have any change. They feel fine here or here.
Hmm.
They're in that window. But other guys, they can't handle those peaks. So I lower the dose, I shorten the interval, and so they have smaller
So
sawtooth.
for the listener, it wouldn't be 100 milligrams of Cypionate a week. It would be 20 milligrams maybe every other day. That way you're breaking up
That's
the thing.
that's one way of doing it. Now, a lot of guys say, "Oh, I don't want to do that." Okay,
That's
yeah,
true. A
okay,
shot every other day. It's not fun.
okay. And then there are some people that have gone on to doing subcutaneous. Okay, well, you can't do that. Well, people are doing it. I haven't seen any studies going into that, but there are other products that have come out more recently that do subcutaneous I think it's enthanate that they're using, testosterone enthanate, but it's a once weekly, and it basically gives a more of a steady state.
What do you mean by, is it mean on the, what do you mean subcutaneous?
Okay, so like if you're injecting insulin, that's subcutaneous. If
Oh, it's
you're
right in your ab.
if
Yeah.
you're injecting testosterone cypionate, you're going to be going intramuscular. So you're going to be going in,
Big muscle, big needle.
inch
Yeah.
and a half. Okay.
And
So
just this probably won't apply to most people, but I'm just curious, real quick, what was the point of Sustanon 250 with the combination of all three, ethanoate, propionate, and cypionate? I don't know if you've heard of that before.
yeah, but I can't comment as an
Okay.
authority on that. I don't
Okay.
know.
It just hit my, so to give the guy some practical examples, endocrine disruptors, make sure your shaving cream, even women, your shampoo, conditioner, because your skin is an organ and it absorbs and all the aluminum. If you're putting deodorant on a couple times a day,
Um,
what we're putting on our skin, that's really the endocrine disruptors.
yeah,
Also, I mean, isn't glyphosate plays a role in that in Roundup and pesticides?
that's nasty chemical.
Yeah,
There isn't any safe level of glyphosate for the human body, and yet it's being found in all the GMO foods.
yeah,
Well, they're Roundup resistant,
yeah.
and so you have companies like Quaker Oats. They went to Roundup oats.
Wow. And just so people know, again, they GMO, genetically modified organism. So they have a friend of mine actually has a PhD in this and does gene splicing and works for Monsanto, believe it or not. And so but he did it for a good reason, trying to get food down in Colombia and different, trying to drought resistant areas. But so what they do is they'll actually splice the genes so you can spray Roundup pesticides on your wheat, and it won't kill the wheat. It will kill the weeds around it because
Right,
the wheat has been genetically modified to be
exactly.
resistant to Roundup ready. So it's just
So
mind-boggling.
the residue is ending up on the
In
plant, and it doesn't
yes,
all come off.
no
And
way.
so I remember in 2018, seeing the report. Oh, wow, a test on Quaker Oats. Okay, and the old-fashioned
Yeah,
big bottles that come like that.
high level.
And they had a fair amount of glyphosate found detected in there. Well, there is no safe level of glyphosate, and it causes cancer. It causes a lot of things. Uh, it's like well, how much mercury or arsenic or what if you knew that was in there? Well, it's just a little bit of arsenic. That won't hurt me.
Right.
So anyway, it's really not good, and we get into those. Uh, the very bad effects on our hormones too. But with regards to the testosterone, getting back to that, as far as the other forms, there are topical forms. There's gels and there's creams and patches. Those actually do give you a steady state, but you do have to put them on every day. The patch, yeah, again, every day. It's not always desirable because you get these red blotches all over your body every time you change it. The topical creams or gels, they can be transferable to other people if you have, small children. If they're in contact, you
Sure,
can
yeah.
rub that off. Um, Generally speaking, if someone is cognizant, aware of that, and they avoid, contact, we're really not going to transfer it much. But you do have to, when you put it on, you're going to have to wash your hands really good, make sure that skin isn't exposed to anyone else. But that is a way you'll get a steady state after about 7 days, roughly.
What
If
I was going to mention, what about, I know there's going to be a lot of women listening on menopause, hormone
yeah,
replacement therapy. What would you say is a percentage of women who don't need hormone replacement therapy who are actually taking it? If they would, change diet, maybe ideal body weight, there's a lot of things that can, I think my problem is,
yeah,
even with myself as I get older, is sometimes we want to run to this therapy but neglect a lot of the primary causes.
right, yeah. So with myself, I monitor my T levels. Uh,
Okay.
I look at those, and I may not have as much as I had years ago, but I really haven't dropped off that much.
Okay.
And I'm just making sure it's not going to drop off. And I'm doing everything I can. But when I started being very mindful of my diet and all the other factors that influence it and eliminating things that will drop it, I, I saw it come up and it stayed up. So that's a good thing. With women, yeah, I try to optimize their diet. HRT is a life issue because there are women, everyone is different. There are women that say 10%. They don't get any hot flashes or sweat. So they say, I don't know what the deal is.
Right.
When I ask people in the field, medicine, well, what's menopause? Oh, well, that's they go through this period where they have hot flashes. Well, okay, well, what if she never had hot flashes? Does that mean she didn't go through menopause? Oh, no, 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 no. Yeah, she went through menopause. Well, how do you know? Well, what's the definition? The definition is cessation of ovarian function and production of hormones. So they drop off. Okay. Some women get vasomotor symptoms. Uh, some don't, and some they continue even 10, 15 years later. They're
Wow.
still getting, well, wait a minute, that can't be. No, they still are. I've had patients, many of them, that have told me about their hot flashes still existing. So, for all these women in the middle, okay, every woman is different. Okay, they're going to experience maybe depression or anxiety. It peaks, it really goes up high in the perimenopause and the menopausal beginning. Okay, but it doesn't drop off that much after things settle a little
Okay.
bit.
So things will
And
settle if they write it out.
yeah, and things will settle out a little bit, but there's cognitive functioning issues. Okay, um, they may not be able to focus, concentrate, multitask,
Okay.
and so for a lot of them, that's devastating. And they see the other changes. I mean, they come in and they're going, "Wow, why do I have all these aches? I think I have arthritis, and my other doctor told me I have arthritis because this came on, and I'm bringing up the hormone levels a little bit. All of a sudden, the arthritis disappears. Well, it wasn't
Wow.
due to so. Yeah, it wasn't osteoarthritis. Especially the clue is that all of a sudden it came out of nowhere. Okay, and I've been having it for 6 months. Well, okay, and they say they're 51, 52 years of age. There's a clue there. But it's a quality of life issue. So they will lose their skin thickness. Their skin becomes dry, becomes itchy. They no longer have lubrication. They become dry down below. They have urinary problems. They can't hold their urine. Um, their hormones are dropping up. Women will drop off 50% testosterone production usually. I mean, the other half comes from the adrenals.
So
Um,
do some women get on testosterone therapy then too? And estrogen just depends what they're on.
yes, yes, but I don't put all women on testosterone. There are some women. I mean, I can't even let them smell this stuff. I mean, they really react. And
Yeah.
other women, I give them a little bit, and they're asking me for, can I have twice as much?
Yeah. Yeah. Yeah.
Because it makes all the difference in the world, and they feel like they have their life back. But every woman is different. And so I just say, I don't know what your template is. We're going to have to figure it out. And it's a little bit of trial and error. It's not one size fits all. And
True. Yeah.
usually the pharmaceutical industry has the model of there's small and large.
Right. Yeah.
That's what it's one or the other.
Yeah. And they never take lifestyle into consideration. They'll never.
Well, no, and no, none of my colleagues are educated on that, and so because it's not taught to us.
What would you recommend then for women before they jump right into hormone replacement therapy? I mean, maybe increasing protein, a lot less sugar, a lot less
Oh,
carbohydrates.
if you get them off their sugar addiction and you get them off their high carbohydrates, especially processed carbs,
Huge.
everything changes.
Yeah.
Everything changes, and your body is able to kind of heal. But the high sugar content that weakens your immune system and it drives inflammation, and that's behind most all of our processes. So, oh my gosh, even the intermittent fasting. I mean, you end up having, we mentioned about growth hormone, after you do a little thing. Well, that's men and women. Okay. And, by the age of 60, our growth hormone is down to almost nothing. Okay. But gee, it's amazing where you can, increase that. You can change growth hormone. You can increase that by doing intermittent fasting or you're familiar with this also. I mean, doing brief hit workouts, okay? So you get the nitric oxide release stimulating mitochondria, but it also stimulates testosterone and growth hormone.
And so people what they hit is high intensity interval training. So you're doing things at a pretty high, I mean, a good it's you're such a rate where you can't really talk and have a conversation is what I tell people. It's get on the bike, do a 2 minute interval, some push-ups, I mean, you're keeping that heart rate high, it's high intensity interval, and that causes the body to increase all those areas.
But I want to distinguish between a high intensity interval training in a short, brief period or a class for 30, 40 minutes.
Yeah,
Okay,
please
I'm
do.
not, yeah, I'm not talking about that because in the studies going back several years, I think it was Dr. Bush. I don't remember his first name, but anyway, Dr. Bush did some of this work and he was looking at this doing 3 to 5 minutes. Okay. If you go past 10 minutes, you definitely get a washout effect.
Yeah.
They didn't see these effects that I just mentioned with the nitric oxide. The nitric oxide hanging around for just a short time, it's concentrated, it's in your muscles, and it's not really dissipating yet. But if you keep working out, that dissipates and you will lose this effect. Okay, if you want to get big, you're going to have to work out, with heavier weights and for longer, okay?
Right.
Or you're going to need to run a distance if you want to build up endurance. But for this brief thing, this is large muscle groups, okay, rapidly activated for brevity, short period of time. So some people refer to it as the nitric oxide dump. Okay, so the nitric oxide has time. And if you do that, say 2-3 times a day, you get more bang for your buck if you're doing the resistance workout or the cardio workout. Okay, you're going to get more effect from your muscles because of that. Okay, so I know a lot of trainers that incorporate this to get more response from their clientele. Okay, but I've been teaching this to 75-year-old ladies for the last 15 years at least. Okay, and telling them as you get older, you have to work out smarter, not harder. Okay, and you know about blood flow resistance bands, right?
Yeah.
Okay, so and I mean, people out there listening may not know what those are. You can explain, but when you're using them, you're getting a similar effect. You're actually holding on to that nitric oxide. Okay.
They're compressing the area.
Yeah. So the bands are you can use them on your extremities. Okay. You can't use them on your neck.
Yeah.
But it's not a tourniquet. It's just it's down the flow, and it's while you're working out. But you can lift not the super high weight. All you have to do is go say 3/4 of your max, and you will get the same benefit, and you won't have the risk of tearing the muscle fiber in the same way.
That's what I'm telling for practical examples. People could just do some squats at home or some tricep movements or some bicep movements, or even not push-ups, but go down on your knees, maybe have push-ups. I mean, there's a lot of things you can do to be strategic about, moving.
Yeah. Patients, look, you don't have to go to the gym to do this real quickly. Look, I tell them first thing in the morning, okay, I do this every morning. I put on a podcast and I will do like 5 minutes. I might do 2 minutes of push-ups, and then I come up with maybe I probably have 36 different exercises I can do. They're nothing more than calisthenics if you think about it. But I was telling this to a Pilates instructor, and she says, "Oh my gosh, those are Pilates moves," and she says, I know all those. And I said, well, this is how I want you to do them. And it does make a really big difference, and it gets people going. First thing in the morning. Okay, it only takes 5 minutes.
Yeah.
Sometimes I might do 7, but I try to keep it down.